Well, in the USA Today, in the financial section, in the money section, there's a big article about, gosh, it's 2/3 of a page, slow the train to more pain of arthritis. You think, oh, well, maybe they have a new drug. They're going to talk about nutrition. What's going on here? And you read the thing, and he says, well, there's not much you can do about it. What you can do is you can take over-the-counter pain relievers and anti-inflammatories. They'll give you about the same amount of relief as prescription drugs without the risk of addiction. And then, of course, there's surgery. Ultimately, you're going to have surgery, they say, because there's nothing else they can do. You lose some weight is helpful because it takes some of the pressure just from sheer weight off your joints, and that's about it. It's coming out as a new book written by a Dr. Thomas Vangsness, a professor of orthopedic surgery and chief of sports medicine at the University of Southern California's Keck School of Medicine. Well, it's been 21 years, almost to the date now, 21 years since the original Dead Doctors Don't Lie audio cassette tape came out. And it's now 21 years later, and it's still true. Only dead doctors don't lie. Arthritis is a simple nutritional deficiency. It's just kind of an advanced form of osteopenia, osteoporosis. And then when you look at all the misinformation doctors dish out, not only for arthritis, but type 2 diabetes, which is a simple mineral deficiency, not genetic, Alzheimer's disease, a simple nutritional deficiency, not genetic, a doctor-caused disease. Let's see here. We have things like cystic fibrosis. They're still talking about it being genetic when I proved in 1977. Okay, 34 years ago, there was a simple nutritional deficiency. Okay, and then there's muscular dystrophy. We sent Jerry Lewis the information on how to prevent and cure that, and the Muscular Dystrophy Foundation fired Jerry Lewis. Okay, and then you have macular degeneration. I actually have a CD out called Seeing is Believing, because I proved it to one doctor, and he made me the CD. He made me the CD, telling how he was able to, using my system, reverse macular degeneration in 27 out of 27 in the study. So only dead doctors don't lie. What I want you to do is get a hold of the book Dead Doctors Don't Lie, which is in an e-book as well as hard copy, and also the trilogy books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, also Let's Play Doctors in the form of an e-book now. So if you're into Kindles and that kind of stuff, you can get both Dead Doctors Don't Lie and Let's Play Doctor as an e-book. So we're kind of getting up into the modern times. You can get it in the hard copy or the e-books, and of course there's the CDs go along with that. And then, of course, God Bless America is written for baby boomers who are suffering from these types of nutritionally degenerative diseases, and arthritis, osteopenia, osteoporosis is certainly falls in that category. Rheumatoid arthritis is an infection with a bug called mycoplasma, which is killable with combinations of herbs and also with minocycline, a member of the tetracycline family. And then you use something like the Healthy Bone and Joint Pack to support and promote maintenance repair of the damaged joints, joint capsules, tendons, ligaments, connective tissue, bone matrix, bone itself. These things are all simply dealt with to prevent and to reverse. Now, in the Chinese medicine, come a couple of months from now, I'll be 75 years old. And I haven't been to a doctor with me being the patient for 67 years. I've never been on a prescription drug. My health records only contain my birth certificate. If everybody in America were like me, medically, the medical system would be real humble, and maybe they'd start telling the truth. So I want you to contact your Youngevity associate today and ask for Dead Doctors Don't Lie, the book and the CD. Get a hold of the e-book or the hard copy. Get a hold of the CD and the DVD. There's actually a DVD. Get a hold of the Let's Play Doctor book, and also you can get that in hard copy and e-book. And, of course, the trilogy books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy tells you how to deal with osteopenia, osteoporosis, osteoarthritis, degenerative arthritis, Dowager's hump, rheumatoid arthritis, fibromyalgia, lupus, all these things, all these connective tissue problems. Very simple stuff. Don't forget, throw in the Healthy Bone and Joint Pack per 100 pounds of body weight per month, and you'll be able to support and promote maintenance repair of all the tissues that are involved in the musculoskeletal system. Well, I really am looking for some help here. We're growing so rapidly now because the new Affordable Health Care Act is driving people to us as people's insurance gets so expensive they can't afford it anymore. They're looking at the Youngevity programs of education and nutrition. And then, of course, we have people who are financially damaged. There's 92 million people in the working age, 16 to 60, that gave up. They're either on welfare, they're on disability, they're on unemployment for 5 years, supposed to be 90 days, or they're on all three. They've learned to game the system. And we are in trouble here as a country. Well, it's all because of the high cost of medical care. And just remember, only dead doctors don't lie. That's right. Only dead doctors don't lie. So take control. Educate yourself. It's biblical. My people are destroyed for lack of knowledge, right? And so these articles just give me great pain because the doctors want you to believe, and these guys have positions of power. They're a protected monopoly. They're self-policing. They've killed off all their competition through legislation. They're not the big guys because their services are so good. They're the big guys because they've killed off all their competition. Okay? So, I want you to do, get a hold of the books. Dead Doctors Don't Lie. Let's Play Doctor. God Bless America. Get a hold of that Healthy Bone and Joint Pack. Avoid surgery. Give me 90 days. You would never get the surgery. Believe me. We'll be back with more truth, justice, and the Youngevity way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, our medical system gets a D-, and that all comes from the American College of Emergency Physicians.
Now, wait a minute before we go too fast here. Don't we deserve a little something here? Don't we deserve a flourish?
I was remiss.
So now we have another agency agreeing with what we've been saying for 21 years.
Yep, this comes from the American College of Emergency Physicians in this CNN story that is headlined, Support for Nation's Emergency Medical Care Gets D+. And they say this is all...
D+ as in...
D as in dog.
Uh-oh.
So the dogs are ruling the roost on our medical industry. And they say that was the whole United States as a whole. And they say that according to the president of said group, Alexander Rosenau, he says the nation's policies are failing to support emergency patients. Board member for that same group, Dr. John Mark Hirschon, was later in the article quoted as saying, if I'm in a car crash and they bring me to a hospital that's not ready for me, my chances of survival are less. They say that back in 2009, when the same group did this same report, they found that they got a C-. So they've actually been going down. And this American College of Emergency Physicians used 136 measures for grading the states. Rated some categories in 2014, such as better than others. What they rated were things like quality and patient safety, environmental and environment, and some of them got a C, and so did public health, injury prevention, and disaster preparedness. Medical liability environment got a C-. That would be access to emergency specialists, and they believe a lot of that is that some of these specialists have actually moved out of states where they require a lot of high liability insurance premiums, so they moved to places like Texas where they don't require as much. And I found an interesting kind of thread through this whole thing. It said a state-by-state breakdown grading the 50 states and the District of Columbia. The card found that the District of Columbia leads in emergency care support, getting a B-. Massachusetts, Maine, and Nebraska were ranked second, third, and fourth, respectively, getting B-. Colorado got into fifth place with a C+. Worst of all on the list was Wyoming. They got an outright F. Arkansas got a D-. New Mexico, Montana, Kentucky all came out with Ds. They say access to emergency care was lacking in many states. In that category, 21 states got an F. And the front of the class in that category with A's and B's were the District of Columbia, Pennsylvania, Ohio, Massachusetts, and Maine. Medical liability. It was good enough in Colorado, Idaho, and Kansas, and Texas to get A's. Some states got F's. 3 states got A's for policies that support patient safety. Maryland, Pennsylvania, Utah, North Carolina. But 10 got F's in that category, public health and injury prevention. And in that category, Hawaii, Massachusetts, Maine, Minnesota, Oregon, Utah, and Washington all got A's. 28 states got D's or F's. Disaster preparedness. And on the A side, once again, was District of Columbia and North Dakota. Now, the thread that I found interesting through all that was in many of these categories, the District of Columbia ranked with an A or a B, but much better than most of the states. And they're not even a state. It's Washington, D.C. It's where all our esteemed rulers are, and kind of found it interesting that they have better care than the rest of us. But should it surprise us? No.
No.
So,
and of course, they're not obligated to...
As they say, the fish stinks from the head. So there you go.
Yeah, and of course, they're not obligated to take the Affordable Health Care Act health plan either. They were given a pass. They could opt out. That sucks. Why wouldn't the people who voted in for everybody else take it themselves? Well, you're just like you say, Doug. The fish starts decomposing at the top. Yeah, that's why politics stinks all the time. Well, thank you so much for bringing that one up, and I can't wait to see that one in the newspaper tomorrow. That'll be a slide in my presentation. Well, hang on. We'll be back with more Truth, Justice, and the Youngevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to Knoxville, Tennessee, and Gordon, you're on with Dr. Wallach.
Oh, Gordon, you're on the air.
Hi, thank you. I called you about 7 months ago with a spinal issue. P4, 5, and 6 have calcium deposits on, not pointy or sharp, but like a mound. And it transferred pain to my chest area when I did certain activities like walking or carrying things and so forth. And you recommended that I take 2 bone and joint packs, which I've been doing for the past 7 months. Now, I had an X-ray prior to doing that, and I just had another X-ray to see if there was any improvement in the calcium, and there has not been any change there.
Okay, 2 questions. Before we go on, 2 questions. If you had not taken that X-ray and see no change there, did you notice any increase in range of motion, any reduction in discomfort?
I never did have a problem with motion, range of motion, but there has been a decrease in discomfort. I do say that.
Okay,
but
good.
Now,
wait a minute. Let me finish here, and then you can go on. And the reason I ask that, it's not unusual, for instance, when you have something like this, and you have what would be called a peripheral neuropathy, where you either have a bone spur or calcium deposits or swelling, inflammation, putting pressure on a nerve, which causes this almost phantom pain, because the pain is in your chest, but the problem's in your back, kind of thing. And so it's not unusual to see some recognizable relief, and then you do an X-ray and you say, well, the radiologist says it hasn't changed. Well, he's only talking about the calcium deposit. He's not talking about all the inflammation and swelling and stuff like that was putting pressure on the nerves. So you're seeing a pretty typical picture. And I would like to actually see the actual measurements. Was the actual calcium deposits 8 millimeters in diameter, and now it's 7.3, and he's saying, well, statistically it's the same, really hasn't changed much. It's what's going to happen. Is obviously you're getting some benefits, so I would continue. I would ask you one more question. Because of the location of this problem, did you have any rapid heart rates or atrial fibrillation or heart palpitations?
I do have heart palpitations when I put pressure. When I'm sitting, put pressure on that spot, or if I'm lying down, put pressure on that spot. Yes, I do.
Okay, well, great. Now, hang on. We'll be back, and I'll let you ask me some more questions or tell me some more stuff after this. Okay, Doug, let's go right back to Tennessee and Gordon. One more question here for you, Gordon. On this atrial fibrillation, tachycardia, fast heart rate, palpitations, those kind of things, has the severity of them reduced, or has the frequency of them reduced, or is it about the same?
Originally, I wasn't having heart palpitations, but in the last maybe 3 months, I started having them.
Mm-hmm. Okay, well, you're getting some compression of the nerves, the roots of the nerves from in between T1, 2, 3, and 4. And that can result in heart palpitations. So what I would do is advise you to go to a chiropractor and have them look at your back and your neck and see if you can't do kind of a non-surgical adjustment from a chiropractor. And then I want you to call me back after that, and I want you to tell me exactly what he says and what relief you may or may not have gotten. Okay, second question. Go ahead.
Okay, I go to the chiropractor frequently, so I've been doing that right along. So.
Okay, good. So what else can I do for you here? Other than tell you,
keep wondering, how long would you expect it would take for the deposits to
Well, it depends. It depends on the severity of the deposit, okay? In other words, if the deposit is the size of the head of a pin, it should go away in 4 to 6 months. If it's the size of a grape, it might take 6 months to a year. Now, what dosage, how much do you weigh and what's your dosage?
I weigh 170 and I'm taking 2.
Healthy bone and joint packs?
Mm-hmm.
Okay, now have you divided that up so you're getting 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner?
Yeah.
Okay, good. Well, that's what I would have you continue. And again, I would get sort of another kind of update from the chiropractor, and then call me back and let me know what he says. I want to know the words he's going to use for your last 2 or 3 neck vertebrae and your first 4 upper back vertebrae, okay? Give me a call back. Okay, Doug, let's go to callers.
Oh, let's head to Chicago, Illinois. And Sherry, you're on with Dr. Wallach.
Hello, Sherry, you're on the air.
Hi. Thanks for taking my call.
Mm-hmm.
I'll try to summarize really quickly. I'm calling on behalf of my husband, who last February was diagnosed with colon cancer, had surgery. It went well. He was considered cured. It was contained. Now we're in the summer. Now we're in the fall. He's been having some pain. It's now presented again at the osteomosis where they reconnected the colon to the small intestine. He had surgery in February. It's now in 2 of his lymph nodes, and he's considered stage 3. Then we go to Mayo Clinic to get a second opinion, and it tips into the beginning of stage 4 in 1 month while he's healing. What I'd like to know, because he's beginning chemo, he had his first session 2 weeks ago, has his second this Wednesday. They've been telling me do not have him take any antioxidants, vitamins, because they're trying to kill everything. That only encourages cancer cells and healthy cells to grow. I just kind of stumbled across the Fructodian Z and the Youngevity products, and I kind of want to bring it out to him. Can he take these?
Well, the short version is yes, but hang on. I will answer that more completely so you know where I'm coming from after these messages. Okay, Doug, let's go right back to Illinois and Sherry. Let's see here. Well, first, let's review what's going on here. Your husband gets diagnosed with colon cancer. They do surgery. The surgery goes well. They say he's cured. A year later, they say, we got to return here at stage 3. And just very shortly thereafter, you go to Mayo Clinic and they say, now it's stage 4.
Correct.
And so it doesn't sound to me like they've been doing a very good job. Okay, and so I always get nervous when doctors say we got it all, looks cured to us. I just don't like it when they say that. That's when they need to pour on the coals. They may say it would be legitimate for them to say, look, we think things are looking good here, but I certainly wouldn't take a chance. I would redouble your efforts and really, really raise your immune system, protect yourself as much as you can, change your diet, the things you got in trouble, no fried foods, no processed meats with nitrates and nitrites, no oils, no gluten, and really ramp up in the antioxidants. Ramp up, get over 100,000 ORAC points a day, oxygen radical absorption capacity, which is an acronym for ORAC points, is an acronym for oxygen radical absorption capacity, which is a measurement of how many free radicals are neutralized by the antioxidants in your food and your supplements. Instead of being real aggressive on that, they say, well, we got it all now. Hey, we're kicking you out of the hospital. We'll see you in a year. And I really, really, really have an issue with them for that. 97% of the time, according to their own studies, chemotherapy and radiation fail. When you ask them, what does radiation chemotherapy do? Well, it reduces the size of tumors. Okay, that means it's going to cure it. Well, we really can't say that. Okay, so I really get disturbed when they say, you don't want to take the things your body requires to defend itself. Do not take vitamins, minerals. Well, that's absolutely an insane thing. It's like saying, don't take oxygen, don't take water, don't take vitamins, minerals, don't eat protein. It's just an insane approach. My own view is that you really need to redouble your efforts because your husband truly is in danger, and I'm sure they've told you that. When you start going from cured to stage 3 to stage 4 in a very short period of time, it means something's out of control here. Your husband's defenses do not have their arms around this thing. And so, as you point out, fucoidin, a very interesting substance. It comes from a red marine algae from off the shores of Tasmania, which is that big triangular island off the southeastern shore of Australia. It's kind of like our Florida here in the United States, and only it's an island instead of a peninsula. And this red marine algae, there's over 840 studies on it, particularly in the area of cancer, because, Japanese women and men are legendary for having like 10% of the cancer we in the Western world have. And a lot of it's attributed to the regular consumption of these types of sea plants and ocean plants, this red marine algae and that sort of stuff. And so we have several products. We have liquid called Z-Radical, which is a liquid. We have the capsules, which are called Fucoid Z. And certainly for prevention, at least reducing risk, I take 3 of those Fucoid Z capsules twice a day. And I use the Z-Radical in my mix. So I have my Beyond Tangerine, I have Osvex Plus, I put in some Rebound, I'll put in the Z-Radical on this drink, and I have that twice a day, as well as my pills and powders and stuff twice a day. And so that's what I would recommend, is to do that for supporting your husband's immune system. Of course, everybody has to make that decision whether or not they're going to follow their doctor's advice, and the doctor says no vitamins and minerals. I've never seen that turn out well. I want to repeat that. I've never seen that turn out well, because radiation and chemotherapy are mindless. They kill off all the good stuff as well as all the bad stuff. That's why people get so weak and they lose body mass. They just don't do well after chemotherapy and radiation, because they're mindless, they're not selective, and they kill off all the bad stuff as well as all the good stuff. So my advice is, do have your husband take the 90 essential nutrients for body weight, change the diet, which probably got him in trouble, and then he can either have his choice of either the Z-Radical liquid or the Fucoid Z capsules as a way to get more antioxidant points in himself. But this is going to be a fight for his life. This is going to be something that he's going to be have to be obsessive about and proactive if he's going to survive this. Give me a call when you guys make your decision. Let me know what you're going to do. But I would opt for doing the vitamins and minerals, even if you choose the chemotherapy, even if you choose radiation. I would opt personally to do that. Now, you got to make up your mind. Okay, Doug, let's go to callers.
Let's head to Germany. And Gottfried, you're on with Dr. Wallach.
Well, Gottfried, you're on the air.
Hey, Doctor, how are you?
Oh, fine, sir. Welcome. Always glad to have you on.
Thank you. It's regarding one of my downlines in Luxembourg.
Okay.
This guy is type 1 diabetic.
Okay.
He was type 2, and the doctor said he's changed to type 1 with other complications with the eye, with neuropathy, and other things. I've dialed in the protocol for him, but I'm just trying to find out whether he can use the imotalium to repair the damaged cells.
Oh, absolutely. Well, first of all, how much does this guy weigh, Gottfried?
158.
158?
68.
Oh, no, that's his age. How much does he weigh?
Yeah, 168 pounds.
Oh, 168. Okay. And how old is this guy?
He's 52.
52. Okay. I'm always suspicious when type 2 diabetes switches to type 1. And oftentimes it'll happen that way because they may have their type 2 diabetes under control for some months or years with encapsulated or tablet form medicines. And then after a period of a couple of years, it's not working very well, and they switch them over to injectable insulin. Well, I believe that happens because they don't absorb very well, and as their malabsorption problem becomes more progressive, it gets worse and worse and worse, and things that used to work in the pill form 10 years ago now aren't working, so he had to go to the injectable insulin to bypass the intestinal absorption. Now, Shar, you're there.
Yep.
Okay, now somebody gradually loses their ability to absorb nutrients or medicines, and we've seen people who had terrible. You remember Pastor Kreider?
Yep. Yes.
He was taking water pills, right? And he was full of water. So why didn't his water pills work?
Because he wasn't absorbing them.
And why wasn't he absorbing them?
Because he had a gluten intolerance, which just about everybody's got now because of the poison food they're giving us.
Yeah, it's really crazy when you think about it. I mean, right now, a minimum of 70% of Americans, the Shar says, has a gluten intolerance. And I'm sure this is true in Europe, too. This is not a new thing, because Plato, and back in the days, you know, in the first century BC, you're looking at recordings of the old physicians back then, 2,000 years ago, 2,100 years ago, people were sensitive to wheat. There were people who had gluten intolerance back then, even the Egyptian physicians. 3,000 years ago recorded people who couldn't tolerate wheat products, and they would get skin problems, and they'd lose weight, or they'd gain weight, and they would die early. They'd have respiratory problems. The ones that they figured it out on, they'd take them off of wheat products, and they would do very well. Well, hang on, and we'll be back, and I'll give you some information on how to help this guy after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity, the 90 for Life Crusade. And Doug, let's go right back to Germany and our friend Gottfried. Okay, well, just real quickly here, 168 pounds. I'd have him take 2 of the healthy blood sugar packs per month. I also get him an extra bottle of the Sweeties, so he could take 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine Nutri-Crystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and with that extra bottle of the Sweeties, he'll take 3 Sweeties at breakfast, 3 Sweeties at lunch, 3 Sweeties at dinner. Obviously, he also needs to eliminate sugar, carbohydrates, natural and processed. He needs to stay away from fried foods, processed meats with nitrates, nitrites, no oils, margarines, mayonnaise, salad dressing, cooking oils. Also, I'd get him away from any of the gluten, no wheat, barley, rye, and oats, as Shar said earlier, to maximize absorption. Give me a call every couple of weeks. Let me know how this guy's doing. Okay, Doug, let's go to callers. You can squish in one more here.
All right, let's head to Houston, Texas. And Ellen, you're on with Dr. Wallach.
Well, Ellen, you're on the air.
Thank you, Dr. Wallach. I wanted to ask you for my 9-year-old mother, UTI, macular degeneration, and dementia.
Okay, UTI, macular degeneration. What was the last one?
Dementia.
Okay. All right. Well, these are not uncommon. You say she's 90 years old?
86.
Oh, 86. I'm sorry. 86. Okay. Shar?
Yes.
What does this gal weigh? What does your mom weigh, Ellen?
124 pounds.
Okay. It's a little bit bigger than you, Shar. So what would you do for an 86-year-old woman, has chronic urinary tract infections, but I don't believe it. I think maybe she even has degenerative disc disease, and the symptoms of burning in the urination and incontinence and things like that are really a peripheral neuropathy to low back pain. I would really look at that. So degenerative disc disease, macular degeneration of the eye, and dementia. What would you do for this gal?
Well, I would get her on the Healthy Bone and Joint Pack, but then she needs some extra other things, too. She needs some selenium. She needs some de-stress.
Okay. Very good. And also, I'd ramp up on our antioxidants, maybe some Fucoid Z, maybe some OPCTs I like. Even the dark chocolate is a good way to get, a fun way for a little old gal like her to get some antioxidants. Have her take 6 pieces of our triple treat chocolate a day. That'll get up over 100,000 REC points. And how many eggs would you have her eat at 124 pounds for the dementia?
Probably about 6 anyway.
Yep, very good. 6 eggs, soft scrambled butter, or soft poached, soft boiled with soft yolks. It wouldn't hurt also for the dementia, just in case, because of her age, just in case there's some vascular dementia in there, maybe some obstructed arteries in the brain. I would throw in the Ultimate Daily tablets. Let her take 2 of those with each meal. So it'll be 1 bottle a month, 2 at breakfast, 2 at lunch, 2 at dinner. And that'll kind of cover the bases there. And I would like to hear from you. So Shar and I could kind of tweak this for this gal, for your mom. And so if you would call us every couple of weeks, say 2 weeks, 4 weeks, 6 weeks, 8 weeks, that'll give us a good spectrum there. And we'll be able to help her out. Certainly the quality of life will go up. Okay, we only have a moment here, Shar. You got about 30 seconds to share with us. What advice would you give people to stay out of trouble like this? Why would people want to have 6 different diseases when you get older? How do you stop it?
First of all, people got to get on a gluten-free diet no matter what, because it doesn't matter anymore. The food is not what it used to be, and people need to do preventative maintenance. You can't depend on getting any kind of nutrition in your food anymore. It's so obvious.
And so, what would be your basic program?
A healthy start pack at the very minimum. Healthy start pack.
Healthy Start Pack, yeah, 1 per 100 pounds of body weight, exactly. You have to be obsessive. You have to be proactive. Now, Shar, you've been with us for 25 years.
Yep.
When was the last time you went to a doctor for being sick?
Been more than 25 years ago.
Okay, and you've been taking this whole 25 years, you've been taking the 90 for Life program, correct?
I don't miss a day.
You don't miss a day. You're obsessive. We like you because you are obsessive. That's why we love you. Okay, thank you so much, Shar. Thank you, Doug. Thank you, Billy. Superlative job as usual. God bless each and every one of you. God bless our troops, and God bless America.